This Good to Go segment is sponsored by Corewell Health.
Colorectal cancer was once thought of as an older person's disease, but according to a recent report by the American Cancer Society, the disease is on the increase among those aged 55 and younger. Dr. Ben Kieff is a gastroenterologist with Corewell Health, here to tell us more about colorectal cancer and why it seems to be affecting younger people. Hi, Dr. Kieff.
Hi, Catherine. Thanks for having me.
I am glad to. What can you tell us about this trend in colorectal cancer, and is it happening? Are you seeing it here in West Michigan?
Yeah, those are great questions. First of all, yes, we are seeing it here in West Michigan, and I've been at Corewell Health, formerly Spectrum Health, for 20 years now, and we have certainly seen a trend toward colorectal cancer occurring in younger individuals. Historically, we would typically start recommending a colonoscopy for screening in people starting at age 50.
Yeah.
But in 2018, the American Cancer Society began to see a trend toward colorectal cancer happening in younger individuals. And they issued a suggestion at that time that people actually start getting their first colonoscopy at age 45. And then the United States Preventive Task Force supported that recommendation in 2021.
Do we know why the rise, why it's trending so much younger?
Well, another great question. It's thought to be really what they call multifactorial. So there are many different factors playing a role in that. In some cases, we have more obesity in our society. Obesity is a known risk factor for increasing colorectal cancer. And there are also thought to be some dietary factors. Perhaps too much processed foods over many decades has made this shift start to happen. It's also seen in other countries like this as well. It's not just an American phenomenon.
Okay, so that's my next question. Are there some things that we can be doing with regard to prevention? Because that's obviously our best bet, isn't it?
Definitely. The old saying, an ounce of prevention is worth a pound of cure, is always true, particularly in medical circumstances. So the best things that people can do when you're a younger individual, number one, don't smoke cigarettes. Smoking cigarettes is associated with increased cancer of all types, but particularly colorectal cancer. And you want to maintain a healthy lifestyle with plenty of physical activity, trying to keep your weight at a reasonable level. Obesity, as I mentioned earlier, can be a risk factor for colon cancer as well as other types of cancer. And then probably the biggest thing that people can do from a prevention standpoint is to really push and talk to their doctors about getting a colonoscopy beginning at age 45 for average risk individuals. If people have a first degree family member that's had colorectal cancer, then they want to do that colonoscopy 10 years earlier than their immediate family member was diagnosed. So getting a colonoscopy at 45 is critical. Colonoscopy is not just a so-called screening test, but it really is a cancer prevention test, because we as gastroenterologists performing the procedure can go into the colon and actually take out precancerous lesions before they ever turn into cancer, which is ultimately what we all want.
Of course, this early detection is so critical, and yet you talk about the screen, the test. A lot of people say, I can't do it. It's awful. There's no dignity. What do you say to all that?
Well, I would try to reassure them and tell them that it's really a day of your life to kind of get ready for it, have the procedure done, and it can save just tremendous difficulty and suffering on the back end of it. No pun intended, obviously. But it's worth the effort. And with a lot of medical procedures, the more effort that the patient puts into it, the greater the results in terms of benefit to them. And it's worthwhile for everybody.
So let's talk treatment, because you mentioned the ability to, cut out a bad spot, a section or whatever. But what's the latest on treatment?
Well, the treatment for colon and rectal cancer is progressing, by the minute. And there are more treatment options available to patients today than there ever have been before. And really, the ideal scenario that I mentioned earlier would be to have the colonoscopy done, get the precancerous lesion taken care of before you ever even have cancer. But for those individuals that do ultimately develop a colon or rectal cancer, it's typically a multi-group kind of recommendation involving gastroenterologists, surgeons, oncology, or cancer specialists to come up with an ideal treatment program for the individual patient.
All right. Important to catch it, though. Talk to your doctor so you're in there getting that screening when you should. Thank you so much, Dr. Kieff. And folks, for more information, you can visit spectrumhealth.org and search colon cancer. They've got a bunch of information there. Critical to read it. Thank you, Dr. Kieff.
Thank you, Catherine.